Hello everyone, I hope everyone is doing good. Welcome to my nursing educational channel. If you are a student, staff nurse or preparing for any exam, this video will be going to very useful for you and for your learning process. So today's topic is IV cannulation and their uses. So we are going to learn about types of IV cannulation and for their uses. So first, what is the definition of IV cannulation? IV cannulation is a procedure in which a small flexible tube called a cannula is inserted into a vein to gain direct access to the bloodstream. So why we use IV cannulation? We use IV cannulation for those patients who need long-term treatment like IV fluids, antibiotics, then other drugs and medication. So we use this IV cannulation. So what is next? Next is purpose of IV cannulation. Why we use IV cannulation? To administer IV fluids, to give IV medications, to transfuse blood, to maintain hydration, for emergency drug administration. For this all we need to IV cannulation for those patients who need for long-term treatment. So next is types of IV cannulation and their uses. So first is peripheral IV cannulation, or in short form we can say PIVC. Okay. So what is the definition of peripheral IV cannulation? Insertion of cannula into peripheral veins like hands and forearms. So what is the common sites? Common sites of this IV cannulation: dorsal hand veins like back of the hand, mostly commonly used in hospitals for short-term IV fluids and medications. Okay. Then cephalic vein we can found on the thumb finger side of the forearm, and basilic vein we can found in the little finger side of the forearm. Okay. You can see the diagram here. This type of color-coded cannula most commonly we use in hospital sites for short-term IV fluids and medications. Okay. For this uses are IV fluids like IV antibiotics, pain medications, blood transfusion, emergency drugs. Mostly we use this type of cannulation. So next is central IV cannulation or central line. Okay. What is the definition of IV cannulation, central IV cannulation? Insertion of catheter into large central vein. Okay. So what is the common site of this IV cannulation? Internal jugular vein, subclavian vein and femoral vein. Okay. You can see this diagram here. Two types of common sites of vein like subclavian vein and jugular vein. So this IV cannulation, central IV cannulation we use for long-term therapy, long-term IV fluids or medications for the patient who are unconscious, intubated patients, and most emergency and critical patients. Mostly we use in ICU for ICU patients, long-term IV therapy, chemotherapy, for total parenteral nutrition. Okay. For total parenteral nutrition, we use for those patients who are not taking or not able to take orally any liquid or any food. So we use for total parenteral nutrition for those patients. So CVP monitoring, okay, used in critical care settings. We use this central line cannula. So next is peripherally inserted central catheter, or we can say in short form PICC line. Okay. What is the definition? Definition is inserted in peripheral vein but reaches central vein. As per you can see in the diagram that when we insert the catheter, it's directly go through the peripheral vein but reaches the central vein. Okay. Mostly this PICC line or peripherally inserted central catheter we use for long-term antibiotics, for cancer patients, for cancer treatment and long-term IV therapy. Okay. It is safer for long duration use. So we use this PICC line or peripherally inserted central. Next is midline catheter. This is a midline catheter definition. It's inserted in upper arm vein but doesn't reach central vein. As per you can see in this diagram that the catheter, the midline catheter injected through the upper arm vein but it doesn't reach the central vein. Okay, the midline catheter uses for 1 to 4 weeks IV therapy for long term treatment, for long term IV fluid and medications, and for moderate duration treatment. We use this midline catheter for those patients who have poor peripheral vein, repeated failure vein, and for elderly patient, for chronic illness patient, we use this midline catheter for long-term therapy and medication. Next is intraosseous SS. This type of cannulation is only for medical emergency. And what is the definition? Inserted directly into the bone marrow. Okay. This intraosseous SS is used only in medical emergency for cardiac patients, for cardiac arrest patients, severe shock patients, and when IV SS is not possible or fails, we use this intraosseous cannulation, only used for emergency. Next is arterial cannulation. What is the definition of arterial cannulation? It's inserted into an artery. As per you can see this diagram that the cannulation is directly inserted into the radial artery or wrist. Okay, this cannulation is used for continuously monitoring blood pressure for those patients who have septic shock, cardiogenic shock, hypotension patient, to monitor continuously blood pressure, and for those patients who are in mechanical ventilator. Okay, to monitor for oxygenation, for AVG, taking arterial blood sample, for major surgery patients and for trauma patients. We use this arterial cannulation, and most common site is radial artery or wrist, used in ICU and OT. Thank you for watching this nursing educational video. I hope this helped you learn something useful. Stay healthy and keep learning. See you with next video.